Our today's topic is upper limb BCQs, which can be asked to you in your exams. Question number 1 is: a 45-year-old man is being examined as a candidate for breast cosmetic surgery. The surgeon notes that both of her breasts sag considerably, which structure has most likely become stretched to resulting condition. Now you better know the answer of this question is suspensory ligament, which is also known as Cooper's ligament. The answer is D. Now the suspensory ligament of the breast, also known as Cooper's ligament, are the fibrous bands that run from the dermis of the skin to the deep layer of the superficial fascia and are primary supports for the breast against gravity. ठीक है. Ptosis of the breast. Ptosis means drooping of the breast is usually due to the stretching of these ligaments and can be repaired with the plastic surgery. Carpal fascia is the deep membranous layer of the superficial fascia of the anterior abdominal wall. The pectoralis major and minor muscles are the help in the movement of the upper limb and lie deep to the breast and do not provide any direct support structure to the breast. The serratus anterior muscle is involved in the movement of the scapula. Now let's talk about to the question number 2. Question number 2 says a 27-year-old man was admitted to the emergency department after an automobile collision in which he suffered a fracture of the lateral border of the scapula. 6 weeks after the accident, physical examination revealed weakness in the medial rotation and adduction of the humerus, which nerve was most likely damaged. Now in the BCQs, the question or the solving part, how you are going to identify or you are going to choose the option is the muscle which perform the medial rotation and adduction of the arm is the muscle that is subscapularis and teres major muscle, which is supplied by the lower subscapular nerve, which can be asked to you in your exam. Now let's see the explanation. The lower subscapular nerve arises from the C5 and C6. It innervates the subscapularis and teres major muscles. The subscapularis and teres major muscles are both responsible for adducting and medially rotating the arm. A lesion of this nerve would result in the weakness in this motion. The axillary nerve also arises from the C5 and C6, but it innervates the deltoid and teres minor muscles. Teres minor muscles. Okay. The deltoid is a large muscle and covers the entire surface of the shoulder and contributes to the arm movement in any plane. Teres minor is a part of the rotator cuff muscle and it is a lateral rotator. Radial nerve arises from the posterior cord or the brachial plexus. It is the largest branch, and it innervates the triceps, brachii and anconeus muscles in the arm. Spinal accessory nerve is a cranial nerve 11 and it innervates the trapezius muscle, which elevates and depresses the scapula. Ulnar nerve arises from the medial cord of the brachial plexus and runs down the medial aspect of the arm, which innervates the forearm and the hand. Now the explanation has a lot of BCQs that can be asked to you, so it means that these all are very important to learn. Any question can be asked to you from these explanation as well. Question number 3 is a 48-year-old court stenographer is admitted to the orthopedic clinic with symptoms of carpal tunnel syndrome, with which she has suffered with for almost a year. Which muscle most likely become weakened in this condition? Dorsal interosseous, lumbricals 3 and 4 thenar, palmar interosseous, hypothenar. C answer is 3. The thenar muscles, lumbricals and 1 and 2 are innervated by the median nerve, which runs through the carpal tunnel. The carpal tunnel is formed by anteriorly by the flexor retinaculum and posteriorly by the carpal bones. It is another MCQ. Carpal tunnel syndrome is caused by a compression of the median nerves. Third MCQ, due to the reduced space in the carpal tunnel. Carpal tunnel contains the tendons of the flexor pollicis longus, flexor digitorum profundus and flexor digitorum superficialis. Question number 4. The dorsal interosseous, lumbricals 3 and 4, palmar interosseous and hypothenar are innervated by the ulnar nerve. Okay? Question number 4. A 45-year-old man arrived at the emergency department with injuries to his left elbow after he fell in a bicycle race. Plain radiographic area and magnetic MRI examination shows a fracture of the medial epicondyle and an injured ulnar nerve. When you have seen that there is a fracture at a medial epicondyle, it means that there is ulnar nerve. And ulnar nerve supplies which muscle? Flexor carpi ulnaris. So the concept is clear cut. Okay. Now you can see the other muscles. Now the nerve continues to the hand. The flexor digitorum superficialis is innervated by the median nerve, and bicep brachii by musculocutaneous nerve. Radial nerve innervates brachialis and supinator muscle. These are few MCQs that can be asked to you in the exam. While walking to this classroom building, a first year medical student slipped on the wet pavement and fell against the curb, injuring his right arm. Radiographic examination showed a mid-shaft fracture of the humerus, which pair of the fracture was most likely injured at the fracture site. Now you better know that at the radial mid-shaft fracture, which structure is present? Radial nerve and deep brachial artery. Okay, now you can see that the fracture of the, there is an MCQ which can be asked to you if there is an injury on the supracondylar fracture. There is an injury to the median nerve that occurs by falling on an outer striatum and partially flexed elbow. Fracture of the surgical neck of the humerus can injure the axillary nerve and posterior circumflex artery. Subscapular artery and nerve can be injured in a shoulder dislocation. Long thoracic nerve and lateral thoracic artery may be damaged during a mastectomy procedure. Mastectomy means the removal of the breast. Question number 6 is an 18-year-old man is brought to the emergency department after an injury while playing rugby. Imaging reveals a transverse fracture of the humerus about 1 inch proximal to the epicondyle. Which nerve was most likely injured by the jagged edges of the broken bone at this location? The answer is B, median nerve. So supracondylar fracture often results in injury to the median nerve. The course of the median nerve is anterolateral, and at the elbow it okay. Now the which I was telling you that at the axillary nerve passes posteriorly through the quadrangular space accompanied by the posterior circumflex artery and winds around the surgical neck of the humerus. Injury to the surgical neck may damage to the axillary nerve. Musculocutaneous nerve pierces the coracobrachialis muscle and descends between the bicep brachii and brachialis muscle. It continues into the forearm and lateral antebrachial cutaneous nerve. Ulnar nerve descends behind the medial epicondyle in the or you can say, and produces funny bone symptoms. Question number 7. A 52-year-old female band director suffered problem in her right arm several days after strenuous several days after where were we several days after strenuous field exercises for a major athletic tournament. Examination in the orthopedic clinic reveals wrist drop and weakness of the grasp but normal extension of the elbow joint. This point is very important. There is no loss of sensation in the affected limb. Which nerve was most likely to get damaged? The answer is C. Posterior introitious nerve. Radial nerve, basically it descends posteriorly between the long and lateral head of the triceps brachii muscle and passes inferiorlaterally on the back of the humerus between the medial and lateral heads of the triceps brachii muscle. It eventually enters the anterior compartment and descends to the cubital fossa, where it divides into superficial and deep branches. The deep branch of the radial nerve winds laterally around the radius and runs between the two heads of the supinator. This is another MCQ. Between the two heads of the supinator muscle and continues as a posterior introitious nerve. So that is why the answer is posterior introitious nerve innervating the extensor muscles of the arm, because this injury does not result in the loss of the sensation of the skin. Is likely to be the superficial branch of the radial nerve is not injured. If the radial nerve were injured proximally, the woman would not be able to extend her elbow. The branches of the radial nerve to the triceps brachii muscle arise proximal to where the nerve runs in the spiral groove. The anterior introitious nerve arises from the median nerve and supplies a flexor profundus, flexor pollicis longus, pronator quadratus muscles. Some of the areas which seems to be injured in this example. Question number 8 is Question number 8 is a 32-year-old woman is admitted to the emergency department after an automobile collision. Radiologic examination reveals multiple fractures of the humerus, flexion and supination of the forearm are severely weakened. She also has loss of sensation on the lateral surface of the arm. Which of the following nerve was most likely injured? The answer is B. That is musculocutaneous nerve that supply the bicep brachii and brachialis muscles, which are the flexors of the forearms of the elbow, as a lateral antebrachial muscles, cutaneous nerve which supplies such a sensation onto the lateral side of the forearm. Okay. Injury to the median nerve causes paralysis of the flexor digitorum superficialis muscle and other flexors in the forearm, and musculocutaneous and lateral pectoral nerve. The lateral cord of the brachial plexus gives origin to the musculocutaneous and lateral pectoral nerve. There is no indication of the pectoral paralysis. Injury to the lateral cord can result in the weakened flexion and supination. Okay? Here are also the few MCQs that can be asked to you alternatively. Now question number 10 is a 24-year-old female medical student was bitten at base of her thumb by her dog. The wound became infected and infection spread into the radial bursa, the tendon of which muscle will most likely to get affected. C. Flexural pollicis longus. Tenosynovitis is going to be happen, and tenosynovitis in the thumb may be spread through the synovial sheath at the end of the hypothenar muscles, and all the muscles are innervated by the ulnar nerve. This can also be asked to you in the exam. Okay? Laboratory studies in the outpatient clinic on a 24-year-old woman included assessment of the circulating blood chemistry. Which of the following arteries is most likely at rest during the venipuncture at the cubital fossa? It's very easy. Yes. Okay. The answer is A. Brachial. The three chief contents of the cubital fossa are the biceps brachii, tendon, brachial artery and median nerve lateral to medial. The common and introitious arteries arise distal to the cubital fossa. The ulnar and radial nerve arises are the result of the bifurcation of the brachial artery distal to the cubital fossa. Now I am going to make another video that will be part 2.